Well, I became a pharmacist because I always wanted to be a teacher. I come from a family of teachers. My mom, my grandmother, my dad had a teaching degree even though he became a farmer. So I feel like it's in my blood. But when I went to college, I felt like there was maybe something missing. And the piece that was missing was the science portion. So I became a pharmacist because I felt like it was a perfect blend of communicating with patients and helping people, which is kind of the teaching part of it, and also the science part of it, which is actually the pharmacy part of it. I actually work in a unique pharmacy setting where I see patients under a collaborative practice agreement with a physician. So I see them one-on-one. And specifically, I spend a lot of time managing patients' blood thinners. I work in a Coumadin clinic with anticoagulation. I had one gentleman, he's about 85 years old, really nice old guy who's been in our clinic probably for about 5 years. And we monitor his INR levels. We do an interview, assess his adherence and his side effects each time he comes to us. Well, all of a sudden it seemed like his levels were going crazy. They were 5, they were 1, we couldn't figure out what was going on. When I actually sat down and talked to him, one of the questions I always ask patients is, are you using a pill box? You know, with the labeled days of the week, the little containers. He informed me that he was using a pill box. He was using Sunday to store his Coumadin pills, and he was using the other side of the pill box to store his Plavix, which is another type of blood thinner. So no wonder he was actually confusing the two pills, not using the pill box correctly even though he was using it just to store his pills. The result is that we kind of hashed that all out, we educated him, and over the next couple weeks we actually had him bring his pill box and all his medications into the clinic, and we set up the pill box with him. And before long, you know, he was stable again and just needing monthly checks. Pharmacists deserve provider status because we're already providing this care to the patients. I feel like our country is in a healthcare crisis, and in order to solve that problem, we really need every single provider working at the top of their license. One of my wise pharmacist friends always said, do what only you can do, and only pharmacists can be the medication safety experts.